right, thank you everyone for joining us today. My name is Jamie Capuano. I serve as Deputy County Executive. And today we're going to be here to talk about a really exciting new plan. I would like to introduce Amanda Gotto, New Paltz Town Supervisor.
Oh boy. Okay, this thing. Okay, can everybody hear me? Because I'm not a loud talker. Okay, all right. So New Paltz has an exemplary rescue squad. The quality of service, the level of service, we have not only the basic life services, but the advanced life services, and the response time they provide are valuable essential services to all the residents of New Paltz. And this is not a matter of luck. This is the result of the vision and the planning and the persistence of the leaders of this rescue squad and the significant support of our taxpayers. While our squad has always provided mutual aid to our neighbors whenever it was possible, they have fairly recently, in the last few years, developed a business plan that allows the sharing of our services and our costs with some of our neighbors, the town of Lloyd, and very recently, Gardiner. And we are happy to do that while maintaining the same expected level of service to our New Paltz residents. Oh. Okay, even so, New Paltz Rescue Squad is caught up in the same upward spiral of rising costs that we're all experiencing, maintaining and replacing our technology and our equipment, as well as the necessary, highly trained staff to support them, is an issue, and we can use all the support we can get. Our chief, Matt Goodnow, can provide a lot more details on the actual what we need the most. But this county EMS coordinated coverage plan offers a source of funds to communities like ours with functioning rescue squads that are seeking to maintain and share services with our neighbors. The plan also promises a source of funds to expand coverage and establish a regional approach to EMS for those Ulster County communities desperately seeking to provide the essential services to their residents. New Paltz appreciates the effort that county has put into developing this plan and welcomes the opportunity to hear more about it today. Thank you. Oh, and I am recognizing here some elected officials, our mayor, Tim Rogers at our village. Yay, okay, very good. And, okay, David? Okay, I don't see for our Marbletown neighbors here, but maybe they are having trouble finding parking. Okay, all right, thank you. Next is, I forget you. Oh, Jen.
I'll take over. Hello, everyone. I'm Jen Metzger, County Executive, and I want to thank you all for joining me today. Can you all hear? Okay. All right. Great. This mic is a little echoey. So first of all, I want to thank New Paltz Rescue Squad, Supervisor Gotto, and the town of New Paltz for hosting us today. And I also want to welcome Ryan Greenberg. Where's Ryan Greenberg? Right in front of me. Okay. He's EMS Director for the New York State Division of State Emergency Medical Services, and we're thrilled you could join us today. Thank you so much for being here. Our EMS system is facing major challenges that we have to address together. Our residents expect that when they call 911, the appropriate level of EMS practitioner will arrive on the scene, on time, provide immediate medical attention, and transport them to the hospital if necessary. These are the expectations that we all have and that we all should have. The reality is that we have distressing gaps in service in Ulster County, with over a third of our agencies responding to less than 70% of their calls. This is a problem that has been growing over time due to challenges with recruiting and retaining EMS personnel and because of rising costs. At the same time, the proportion of our county's population that is over 65 continues to grow, and that places increasing demands on an already strained system. We have to invest in strengthening and enhancing the EMS system. This is absolutely essential for public health and safety. So you know that expression that there's no such thing as a free lunch, right? And that is certainly the case for EMS. Now, it has always been the case, but volunteer agencies have historically been able to make it work through a combination of local fundraising and an abundance of volunteers. And there used to be more people on private insurance and fewer people on Medicaid, covering more of the costs. None of this is the reality anymore. Today, we present to you our plan to shore up the county's EMS system in the near term while working toward longer-term financial sustainability. This effort has been led by Ulster County Emergency Services Director Everett Erichsen and his team in the county's EMS division, including EMS Deputy Director and Coordinator Pam Finnerty, there she is right there, Michael Beninati, Rich Mullally, and Rich Miller, all of whom are up here with me today. They are all also trained paramedics. Our team knows their stuff. We also have great support in the legislature for our emergency medical services system, including Chair of the Public Safety Committee, Gina Hansett, Deputy Chair Chris Hewitt, Ways and Means Chair John Gavaris, who's a 20-year EMT veteran in Ellenville, Chair Peter Criswell, I see in the back, legislators Collins, Clinton, Sperry, Harmon, and I see Manager Green. I don't know if others are here, but they are all strong supporters of EMS, and so are many of those who couldn't be with us here today. I also want to acknowledge the efforts of legislator Kovacs, who has championed and expanded county role in shoring up the EMS system. We don't agree on everything, but we do agree on a lot, and I really appreciate his continued dialogue with our Emergency Services Department. Today, I'm announcing our proposal for a $4.9 million direct county investment in emergency medical service agencies to help close gaps in service around the county and bolster the services delivered. This includes a $2.8 million investment in the county's ALS anchor agencies to support their cost of readiness. For those less familiar with the EMS system, we have basic life support agencies, or BLS, and advanced life support agencies, or ALS. All are important. ALS includes a paramedic and comes into play when a higher level of care is needed, for instance, for a case of a stroke or a heart attack. The majority of 911 calls dispatched in our county are ALS calls, about 65%, and the investment we're proposing will bolster these critical services. We are proposing another $1.6 million investment in agencies and municipalities. This funding will support the cost of readiness and incentivize a 95% response rate to calls in their areas of jurisdiction. And lastly, as I proposed in my 2025 executive budget, we're creating a $500,000 grant program for EMS agencies to purchase equipment to provide a higher level of care, and will provide the training to use that equipment. Again, our mission at the county is to strengthen and improve the emergency medical service that our residents need. I want to be clear that this nearly $5 million investment we're proposing is meant to help the immediate needs of today. For the longer term, if we want to ensure the most efficient and sustainable EMS system, we need to move in the direction of regional taxing jurisdictions for EMS based on regional coverage levels. This is the fairest and most reliable path forward to ensure that EMS is able to provide the level of service our residents need for the long term. Before I introduce the next speaker, I just want to point out that we've prepared a couple of handouts for you all. Many of you are in the profession, but for those of you who are less familiar with EMS, one of the documents provides just key terms and concepts for understanding our EMS system, and the other includes our kind of summary of the challenges we're facing and the solutions, as well as this map here, which I urge you to take a look at because it's a heat map that shows the gaps in coverage that we're currently facing here in Ulster County. And that's what we have to solve for. Okay. Thank you so much. And I'd like to introduce our next speaker, Ulster County Emergency Services Director, Everett Erichsen. Thank you so much.
Thank you. Good morning, everyone. Thank you for attending. I would first like to start off by thanking County Executive Jen Metzger and Deputy Executive Jamie Capuano for their support and dedication to ensuring we build an emergency medical services system that meets the needs of our county. I'd also like to thank Legislator Kovacs for championing, Executive Metzger says, championing EMS and help us moving it forward. I would also like to, again, recognize the EMS team led by Deputy Director Pamela Finnerty. They do a tremendous amount of work, and they have the interest of our residents in mind. And then also Dr. Matt Stupple, who is our future medical director to help us with our programs that I'm going to be talking about today. And lastly, I would like to thank the EMS agencies and municipalities that have adequately addressed their emergency medical services needs for their continued dedication to patient care, not just within their home jurisdictions, but the county as a whole. So collectively, we should have one common goal, and it is the mission of the Division of Emergency Medical Services that work with the EMS agencies throughout Ulster County to ensure emergency medical services is patient-centered, accountable, and sustainable. Like many counties across New York State, Ulster County is confronting critical EMS challenges. One, an increased demand for emergency medical services coupled with a significant shortage of paramedics and EMTs. Two, insufficient cost of readiness funding. And three, increased call volume. This has created substantial gaps in emergency medical coverage, placing unprecedented strain on local EMS systems and requiring an innovative, comprehensive approach to ensure we support a patient-centered, accountable, and sustainable emergency medical services system. The Division of Emergency Medical Services, in concert with EMS agencies, will implement an EMS coordinated coverage plan. This plan represents a strategic response to these challenges, designed to bridge disparities in advanced life support and basic life support services, to which over 50% of our municipalities in Ulster County lack dedicated advanced life support. Through targeted financial support and systematic coordination, we will enhance advanced life support in these municipalities. At the heart of the plan are the anchor agencies, advanced life support providers with a proven track record of maintaining at least a 95% monthly response rate in their home jurisdictions. With county funding, these agencies will serve as critical response hubs, providing supplemental essential coverage to municipalities struggling with limited EMS resources. Funding as part of this approach is $2.8 million strategically distributed through multiple mechanisms. A front-loading approach providing 50% of the funding up front, allowing agencies to immediately address critical operational needs. This funding further supports agencies maintaining high response rates, creating a dynamic system that financially supports reliability and efficiency. Additionally, an added allocation of $1.6 million will support basic life support and advanced life support agencies who will meet response performance standards. Funding allocations is aimed to consider multiple factors: a percentage of municipal assessed value, total population, and call volume. This approach ensures a balanced distribution that considers both community resources and service demands. Recruitment and retention initiatives aim to increase response percentages and to reduce dispatch and response times. Exploration and development of paid staffing platforms. Payments for services rendered, and financial education and development initiatives with concentration in billing, as well as capital equipment. A critical enhancement in agency rostering, which involves real-time reporting of EMS resource availability. Agencies must update their status through a county IM responding service, providing the 911 communication center with immediate visibility into resource allocation. This system enhances coordination, minimizes service disruptions, and optimizes emergency response capabilities. County Executive Metzger included several initiatives in her 2025 executive budget designed to expand the pool of trained EMS professionals in Ulster County and incentivizes service in the field. These initiatives include Ulster County, in partnership with SUNY Ulster, is seeking approval for our New York State course sponsorship to offer New York State EMS certification programs, which will broaden the county's training capabilities by offering the New York State Emergency Medical Technician Certification course. The county will also incentivize certification and service in the field with a work-study stipend, modeled on the state fire training stipend. Personnel that complete the EMT course and volunteer in Ulster County will receive a $2,000 stipend. A new EMS training unit, similar to the Division of Fire Services Fire Training Unit, will provide an increased level of training, and the EMS division will offer a variety of CME topics throughout the year. The plan benefits are multifaceted. It enhances system-wide coordination, provides financial support for recruitment and retention, and creates a more resilient emergency medical infrastructure. By investing in agencies, supporting workforce development, and implementing strategic coverage expansion, the plan addresses immediate service gaps while building a sustainable long-term solution for Ulster County's emergency medical services. Importantly, the plan includes accountability measures. Agencies changed with performance criteria will work closely. Agencies challenged with performance criteria will work closely with the county to develop solutions, ensuring that no community is left without critical emergency medical support. This approach demonstrates a commitment to a continuous improvement and responsive emergency medical service delivery. Ultimately, the EMS Coordinated Coverage Plan is more than a funding mechanism. It is a comprehensive strategy to transform emergency medical services in Ulster County. By addressing workforce challenges, providing strategic financial support, and creating an innovative coordination mechanisms, the plan offers a forward-thinking solution to the complex challenges facing emergency medical services in the modern healthcare landscape. I would now like to introduce Town Supervisor Marybeth Majestic of the Town of Gardiner.
Hi, everybody. I am a little less prepared than my previous speakers. I'm just going to go off the cuff here. So the Town of Gardiner was asked to attend a meeting back in October by Everett and his team, and along with other municipalities in the southern end of the county, Marlborough and the town of Plattekill. And we met, and it was pointed out to me that our response time in Gardiner was less than ideal, and our backup, the town of Plattekill's response time, was worse than ours. Oh, okay. Well, this is what I was told. I don't fact check everything that I'm told. And so what the town of Gardiner did, it was budget season, so we discussed it amongst the board, and we took a small amount of money and we put it in the budget for emergency management services. We weren't quite sure how we were going to use that money that we set aside, but Everett kind of figured it out for us. And he proposed a solution with the town of Gardiner that we would contract with Ulster County, and Ulster County would contract with New Paltz Rescue to provide supplemental services to the town of Gardiner, supplemental ALS services to the town of Gardiner from June 1st to December 31st, which is a great start for our town, but it's only a start. The second part of it, which Everett alluded to, is that the town will work on establishing a town-wide ambulance district, EMS district, and people will be taxed on that so that it can be more sustainable. We're grateful for any assistance we get from the county, monetary assistance in coming up with plans, But the main thing is that when people in Gardiner or any other town in the county call 911, they expect a response. And we're happy to work together with the other players to make that happen. And I'm grateful for the cooperation we've had with the county, but I'm even more grateful for all the people that respond to these calls, no matter what day of the week, what holiday it is, whether they're leaving their child's ballet recital. The gratitude that I have for our paid and volunteered service members is just immense, and I thank you all for all you do. And with that, I get the privilege to announce and introduce Matt Goodnow, who's the Chief Executive Officer of the New Paltz Rescue Squad and the Chief of the Gardiner Fire Department. So thank you, Matt.
Thank you, Marybeth. First, I wanted to go around the room and thank a few people. I'd like to offer thanks to Jen Metzger. You know, she's been giving attention to EMS in every position that she's held. I met with her years ago when she was in a different elected position on how to solve this problem. So she's continued to support us. Next, I'd like to thank Everett and his team. They're really doing good work. They're working hard. They're moving us forward. I'd like to take a moment to thank Director Ryan Greenberg for taking the time to come down. He, on his end at the state level, is constantly working, pushing things forward to the governor to have systems in place so that we can look at our gaps in the state and how to address them and work on addressing them. I'd like to thank David Violante for coming. He is our chair of our SEMSCO at the state level, but he's also a local and has been addressing these issues on the local level for years. A regional approach to EMS is the most effective way to get to people no matter where they are. New Paltz Rescue was founded by citizens who came together when they saw a need. Their mission was to render first aid and services to the residents and the visitors in the town and village of New Paltz. Our mission hasn't changed. Our area is just broadened. We believe that we can provide effective response to the towns that are adjacent to New Paltz in a timely fashion. Working with the county, we're going to be able to do that as we did with the town of Lloyd. Today, our mission is unchanged, and we look forward to working with the county and our other agencies throughout the county, these anchor agencies, the BLS agencies, the volunteers. All of us working together can solve the needs to the sick and injured of Ulster County. So I thank everybody for coming. I thank the county for stepping up, and I look forward to working with everybody to solve the problems as they continue.